Good afternoon, everyone. Thank you for joining me at another Tuesday Tips. I am your host, Sharon Johnson with Train 51 Healthcare Consulting. Our tip of the day today is the power of budgeting in physician practices, a key to success. I realize this is not the most scintillating topic we're going to talk about today. However, independent physician practices of varying sizes, scopes, and business models face numerous challenges in maintaining financial stability while delivering high quality patient care. One of the most powerful tools at their disposal is effective budgeting. From a mere financial exercise, budgeting is crucial in a medical practice's overall management and success. So let's explore the key benefits of implementing a robust budgeting process. If you're not new to this, this would be just a refresher to you of what you're already doing currently. If this is new to you or you're looking to endeavor starting a budget, this helpful tips hopefully will be able to guide you into starting your budgeting process. So let's dive right in. We have a few topics to dig deep into, and hopefully this will be very helpful to you. Financial stability and planning. At its core, budgeting provides invaluable financial visibility to physician practices. By creating a detailed budget, practice managers and physicians clearly understand projected revenues and expenses over a specific period. This foresight allows for better planning and decision making, ensuring the practice can anticipate and prepare for future financial needs. With a well structured budget, practices can forecast income from various sources, including patient services and insurance reimbursements. So, this is a forward looking approach helping to evaluate progress towards your practice's financial goals, such as expanding services, perhaps, hiring new staff, or investing in new equipment. Moreover, it allows practices to anticipate potential financial challenges and plan accordingly, creating a more stable and sustainable operation. Furthermore, I recommend establishing a time frame for budgeting for purposes. Administrative and physician leadership meet to discuss annually the practice budget. So, whatever your fiscal year looks like, whether that's a calendar year, January to December, or if it's fiscally, meaning July 1st to June 30th, then you would decide when in those annual when the meeting is going to be just to discuss the budget. Our second topic is called cost control and operational efficiency. So let's think about this a bit like in like our household, right? In our homes, we have budgets that we look at to see whether are we increasing our expenses? Is there a decrease in expenses? Is it just flat? We're pretty much, remaining the same. So one of the significant advantages of budgeting is its role in cost control and enhancing operational efficiency. So, by closely monitoring expenses against budget amounts, practices can quickly identify areas where costs exceed expectations. So, whatever you had budgeted, for example, in supply costs for that year, you can see if the trend is looking towards an increase or a decrease or just remain the same. This awareness allows for timely interventions to control spending and reduce waste. For instance, if the budget reveals an unexpected increase in medical supply costs, management can investigate the cause and implement measures to address the issue. This proactive approach to cost management is crucial for maintaining profitability, especially during economic uncertainty or fluctuating volumes. Our third topic is called informed decision making and resource allocation. A well crafted budget is a financial roadmap that guides critical business decisions in a physician's practice. With a clear understanding of the practice's financial health and future projections, managers can make informed decisions about investments, expansions, and resource allocation. So, for example, the budget might indicate that while overall revenue is stable, cash flow tightens during specific periods due to seasonal variations in patient visits. So that may be your summertime. Patients are out on vacation. That might be a slow time for patient visits. Armed with this information, practice managers can plan major expenditures during more financially stable periods or establish cash reserves to ensure liquidity during leaner times. Moreover, budgeting helps prioritize spending, ensuring that resources are allocated to areas directly impacting patient care and revenue generation. This might involve investing in new technologies to improve patient care or streamline administrative processes, ultimately enhancing the practice's efficiency and quality of service. Next topic is staff engagement and accountability. Involving staff in the budgeting process can significantly boost engagement and foster a sense of financial responsibility throughout the practice. When team members understand the practice's financial goals and their role in achieving them, they're more likely to be mindful of expenses and work efficiently. So, for instance, staff aware of patient volume targets may be more motivated to enhance patient engagement and ensure timely filing. In the case of maybe medical supply, is there any way that they can utilize the supplies in a more conscientious way and not and reduce waste? This transparency can lead to a more cohesive work environment where everyone is aligned toward common financial objectives. One way to put that visibility in your goals, if you have a lunchroom that you can put high level in terms of where your financial goals or what you're trying to do for the practice so that the staff can also visibly see that. Another way is through your team huddles or monthly team meetings, to emphasize what financial goals that you guys are trying to do on a monthly basis. Just a few recommendations and suggestions. Again, it's according to your practice size and scope and capacity to be able to communicate that information to your staff. Next topic is preparedness for external changes. So we have to take a look at what the external atmosphere is also affecting what's inside the practice in terms of our budget. So the healthcare industry is known for rapid changes, from shifts in insurance reimbursements to new regulatory requirements and even technology, as we've seen topics about AI. A comprehensive budget helps physician practices prepare for these external changes by incorporating contingencies and building financial reserves. This preparedness allows the practice to navigate challenges without facing a financial crisis, ensuring continuity of care for patients. So it's really important that you take the time and carve out a time to meet and talk about the budget. Look to see what are your trends in relationship to costs in terms of expenses, your resource allocation, and so forth. And remember, each practice is different in size, scope, and business model. They're not the same by in any means. And what would that budget look like for you? By embracing budgeting as a critical component of practice management, independent physician practices can enhance their financial stability, improve operational efficiency, and position themselves for future growth. In doing so, they secure their financial health and ensure they can continue providing high quality care to their patients in their communities for years to come. So, don't be afraid of creating a budget, realizing that, again, that is not the most scintillating topic that you would be discussing. However, your financial health and having at least either a high level or not in terms of detail for decision making, yet that's also helpful too, to know some of the granularities of where the cost is coming from from a budget perspective. But it's a good way to have a pulse check in your financial health and making sure that you are reviewing the budget, you are looking at your roadmap, seeing where the practice stands financially so that you can make informed decisions whether you need to expand your services, um, ex- update your technology, and also resource allocation. If it's not those, it could be a decrease in your practice, or it could be a decrease in a service that it's not projecting the way you had intended it to be, and also perhaps a decrease in resource allocation. So again, those things will be helpful in making that informed decision with a budget. So I hope this tip of the day was helpful for you. I look forward to another Tuesday Tips. I am your host, Sharon Johnson from Train 51 Healthcare Consulting. Have a great day.